Hello.
Welcome to 97-year-old Doris Seaman's living room and the front line of a service in crisis.
No one's been in this morning. No, never mind. So what would you like for lunch? You have got...
Doris is one of hundreds of thousands of elderly or disabled people who rely on help either in their own house or in a care home.
Very, very important, because if I didn't have them, well, I'd have to go into a care home or whatever. I didn't want that.
Doris's carer, Josie, came out of retirement to help out during the pandemic. A chronic shortage of carers in Norfolk and across the country means she's not stopped working since.
Some weeks I do maybe 5 or 6 days. I only really wanted to do 1 or 2, but you can't leave them without care.
How long do you think you can keep going?
Not forever. Just, you know, I am getting tired, obviously. So hopefully sooner or later some more staff will come along and we can cut it down a little bit.
2 years ago, Boris Johnson made a promise.
We will fix the crisis in social care once and for all with a clear plan we have prepared.
But the crisis is far from fixed, according to those working in social care.
This crisis is here now.
Yeah.
It's here today.
Yeah.
It's here this weekend. We're going to have people without care this weekend, and these words will do nothing to address that.
The government says £500 million will be spent on supporting and developing the care workforce from next year, part of the new health and social care levy. But for these care providers in Norfolk, that's too late. Nationally, there are 100,000 unfilled vacancies, and they say making vaccines compulsory for carers will only make things worse.
You say this is the worst crisis you've seen in 20 years. What are the implications of that?
I think it's so serious that people will die. I think that people will go home from hospital without appropriate care. I think people will need to go into hospital and there'll be no one there to raise that flag, to call the ambulance.
How does that make you feel?
Myself and other providers I've spoken to are devastated with the position we're in.
81-year-old Janet Holmes knows all too well about the crisis in social care. Her care package ends on Monday because the provider says it doesn't have enough staff to continue the support.
Well, I just feel completely let down, you know, and I'm just sort of thinking, come Monday, what will I do? I mean, I've got to get myself up, which will be quite it's, the pain of getting out of bed is really severe in the morning, and even after taking the morphine.
How are you going to cope?
I really don't know. So, comes Monday, I'm on my own.
Janet's care provider says she's one of 15 clients she can no longer support.
It's mainly down to recruitment, so we're not being able to recruit new people. Staff wages are low in this industry.
Isn't that up to you to give wages, fair wages to your staff?
So we only get paid a certain rate by the council, and that is set by them. We can't ask them for any more money.
The Conservative leader of Norfolk County Council says he'll have to increase council tax if there's no extra money from central government.
Well, the only way we can do it is to raise the taxes locally, which comes back to that other circle of moving of taxation from central to local government. But government have got to step up in this situation and recognise that what's been done so far, I accept, is a partial fix. It's not a total fix. We need it to be totally fixed.
Back at Janet's house, her son has come round to get her supper. He's horrified that her care provider is pulling out.
It has nearly brought me to tears, worrying about how Mum's going to cope with this. You know, I wish I could be here 24 hours a day to help her, but I just can't because I've got a family. I have to go to work. I can't afford not to work. So we have no choice at the minute.
I can see you're emotional now.
Yeah, it's a bit tearful, yeah.
After an approach by Channel 4 News, Norfolk County Council now says its in-house team will provide temporary support for Janet. Finding another private care provider might take a little longer.
Jane Dodge there with that special report. But joining me now is Jane Townsend, who is Chief Executive of the UK Home Care Association, which represents providers of care in people's own homes. Thank you so much for coming on the programme. I mean, the human drama outlined there in Jane's report is really quite extraordinary. But would you agree with the assessment of one of the experts in there that people might die if this isn't fixed?
First of all, just want to say how very sorry we are for Janet and her family and for all the many other families across the country that are experiencing a similar situation. And our members have been very concerned for a long time that older and disabled people like Janet will end up being without care potentially, because we're experiencing the worst workforce shortage that any of us can remember.
But could people die if this isn't fixed?
Potentially, because there are people with unmet needs in the community waiting to be assessed, and councils are struggling with the resources to do that. Hospitals are struggling to discharge people back home, and quite a substantial number are being placed in care homes, which is not necessarily their choice. So it is a very serious situation.
The government obviously acknowledges this, and which is one of the reasons why they launched this, what they call an unprecedented package last week, £5.4 billion to be spent over 3 years. I mean, they are doing something to try and fix this. Would you acknowledge that? Does this go, in the right direction for you?
Well, there are some aspects of it which have potentially positive outcomes in the sense of avoiding extremely high costs for certain people, but the number of people that have had to sell their houses to pay for care homes is relatively small in the great scheme of things, maybe 20,000 people a year against 400,000 that live in care homes and 850,000 that receive support in their own home. And the amount of money that the government has given, 5.4 billion for social care compared with 30.6 billion for the NHS, is just not, it's not going to scratch the surface. It's not going to help us address these workforce issues. It's not going to help us with wider reform. And yes, they've given 500 million for training, but that works out at £100 per person per year in a workforce of 1.5 million. And even assuming that they can get better training and qualifications for that money, there'll be no extra money to give them any pay to reward them and recognise them for those additional qualifications and training.
And where are the numbers worse? Is it in care homes or those people who need care at home, in their own homes?
I think it's very difficult everywhere. We've seen a rise in demand for home care. And at the same time as we've seen a rise in demand, recruitment and retention of home care workers is worse than it's ever been. And there are a number of factors that driving that: poor pay terms and conditions, competition with other sectors such as tourism, hospitality and retail, care worker exhaustion. Many of them have been working non-stop all the way through the pandemic. They were out and about visiting people in their own homes when other professionals were remote working from home. And migration policy and Brexit, and also some of the COVID-19 policies you mentioned, vaccination as a condition of deployment. We don't yet have that in home care, but the government is consulting on that. We believe that they intend to push that through.
Okay.
And in some areas, we could lose 20 to 40% of the workforce.
That's very dramatic. Just finally on vaccinations, you can see why the government and indeed many residents in care homes or people who are being cared for would want those staff to be vaccinated. What's the way around this? I mean, how do you get them vaccinated and retain them?
We've been strong supporters of vaccination all along and are really working hard to ensure that as many as possible do receive a vaccine. In home care, we have about 81.5% of home care workers have had their first vaccine and nearly 70% have had their second. What we're doing is working closely with NHS England, Public Health England, to try to persuade the remaining ones to have the vaccine, because obviously that protects them. All the way along, though, it needs to be stressed that home care workers have worn the correct PPE. They've had regular asymptomatic testing for COVID-19 and other infection prevention and control measures are in place. And I would like to say too that during last year when we didn't have vaccination, and for much of the year we had to fight even to get routine asymptomatic testing, death rates in home care were very low compared with care homes, and tracked really what was happening in the wider population. The reason the government gave us last year for not making routine asymptomatic testing available was that home care was considered a low risk. So I think we're questioning now whether the risk of losing care workers, leaving older and disabled people without any care at all, to balance that against the risk of unvaccinated care workers who all will be using PPE testing and other measures.
All right, I'm afraid we've run out of time. Jane Townsend, thanks very much indeed.